So in the previous slide, we talked about the respiratory function of the diaphragm, and right now what we're going to do is we're going to talk about the postural function of the diaphragm and breathing. So for postural control and stabilization, we're going to start looking at the abdominal muscles, the rectus abdominis, the internal and external obliques, and the transverse abdominis. Now the rectus abdominis is a huge player in bowel movements, childbirth, and coughing. Now that's interesting because in primal reflex release therapy, a treatment for inhibition of the first rib elevation, scalenes attached to the first rib, other fascial connections, those are accessory motions for breathing, very much up here. To inhibit that, we have our patients forcefully cough and activate the rectus abdominis. So we're trying to facilitate a more proper function of breathing. Internal and external obliques, specifically external obliques, those will actually pull the ribs from a more externally rotated position to a more internally rotated position. And also the pelvis, it will pull it more posteriorly rather than have it dumped anteriorly. This muscle is actually a huge player in PRI, Postural Restoration Institute activation for respiration. They want to facilitate the ribs coming down, a posterior pelvic tilt to kind of bring back a balance of postural alignment for the pelvic floor and then the diaphragm. So if this is my diaphragm here and this is my pelvic floor, when we look at posture today, a lot of people are anteriorly rotated in the pelvis and their ribs are more externally rotated to compensate for improper breathing patterns. So what we're trying to do is we're trying to bring it back here and have this wonderful zone of opposition. I'm going to get into that in the next slide, but just so you guys have a reference. Internal obliques are more superficial, and that's more of a forced respiration muscle, and we really don't need that since we're already so much here. So much chest breathing, so many accessory muscles used, that's not really helping us. The transverse abdominis is more important for lumbar stabilization. As I mentioned before in the previous slide, the diaphragm has connections onto the lumbar spine and can actually be a lumbar stabilizer. Now, as I mentioned before, if we're dumped this way, what is our lumbar spine doing? It has a more lordotic curve that's not really stabilized. It's not being helped at all. That puts our abdominal muscles in a more lengthened and inhibited state so they can't actually function to do their job, creating pressure, allowing proper movement of the diaphragm and even the pelvic floor. So a study conducted by Hodges et al., they actually did an EMG study of the different demands for diaphragm control and pressure in the thorax and in the abdomen for stabilization of the lumbar spine, and they wanted to see over time like if that would change. Now they realized with the higher demands of breathing function, like respiratory need, the diaphragm was no longer able to perform its duty as a spinal stabilizer, so that actually declined. So if you think about all the people that are working out nowadays, they're walking around with all this dysfunction and all these compensations. The higher demand for breathing, nothing's really helping them with spinal stabilization. A lot of cases looking into low back pain in the literature, we're seeing a lot of breathing related issues that are contributing to low back pain, which in a few studies, especially by Boyle et al., reported that low back pain was reduced with the implementation of proper breathing techniques. We're going to look really quick at the pelvic floor. Craniosacral therapy by John Upledger actually kind of separates the diaphragm into three separate parts. Specifically, we have the respiratory diaphragm, which we talked about already, but we also have the pelvic diaphragm. Now, the pelvic diaphragm, we've got the urogenital area. It's kind of like a hammock of tissue that allows the organs to kind of rest upon. As I mentioned in the previous video, for exhalation, that muscle down there, the pelvic floor has to activate to kind of force air out. But inhalation, it has to kind of relax to allow displacement of visceral organs. If we're here, that really can't happen. So we kind of have to take a look at a bigger picture. We have not only the diaphragm here, but we also have the pelvic floor.